Morning. Chris Ohl, Wake Forest School of Medicine, Infectious Diseases. Driving in this morning, I think we're at peak colors here in the Piedmont, North Carolina. It's been a real pretty week. And as the leaves slowly fall, so do our COVID rates slowly. Our numbers this week, if you're keeping track on your charts, is 14 cases per 100,000 per day here in Forsyth County. Guilford County actually was at 14 a few days ago, and they've ticked up. There were 15, then 16, and then this morning now it's 17. But here in Forsyth, we continue to fall a little bit. The counties around us are mostly in the 20s. Rockingham's in the lead for our area at 33. If you just to reiterate, what we look at to see where we're at with COVID is we look at our rates per day. The CDC actually counts it per 7 days, but I do it per day because I think it's easier to understand and remember. And then we look at our percent positivity for tests. So here in Forsyth County, we're at 4.7. Have been under 5 now for about a week. Here in Winston-Salem, we've set some metrics to be roughly at around 10 cases per 100,000 per day, and to have 2 weeks of percent positivity less than 5%. I think we'll probably hit that the last week of next week. It's next week now, the week before Thanksgiving, probably towards the end of it. So when we hit that, I think the citywide mask mandate will be rescinded. Guilford County might be a little bit further behind that just because their numbers aren't coming down quite as fast. What does that mean? Well, it means you don't have to wear a mask to go inside by Winston-Salem's proclamation and law, I guess it would be. But it doesn't mean you shouldn't. So particularly when going into places where there's a lot of people, where it's crowded, or if you're immunocompromised or have a lot of underlying health conditions, continue to wear your mask. I think for schools it probably makes sense to stay masked until the end of the year, and then we'll figure out what to do with the spring semester over the holidays. Why do that? Well, one reason is that we've got influenza, good old flu around now, and we're getting reports of both influenza A and also influenza B, particularly B in kids. And we have a pretty good-sized outbreak right now at Wake Forest University, influenza. It's kind of interesting. There's several college campuses across the East Coast that are having trouble with flu right now. Florida State was, I think, in the news because their football team got affected by it. I hate to say it, but I think I predicted that flu would be back this year, as well as our other respiratory viruses. And, masks protect against those too. So influenza can be just as disruptive to a school or a workplace or as a hospital as COVID, really. Not quite as dangerous. Mortality and morbidity is not quite as high. But it certainly can be disruptive. So I think it would be a great idea for the schools just to stick with it until the Christmas holiday, and then we can sort out how the season's going to look. And if it's looking good, then we come back unmasked in the spring. Our schools are doing pretty well. We've been having some discussions about using testing to modify length of quarantine time, which I think particularly, it is for the unvaccinated kids. I think parents would feel a little bit less stressed if quarantine times came down. Using a testing approach, we can do that. I ask people to be a little bit patient with that because it takes a while to get the tests are in short supply, and we also need to get people trained not only on how to do this in-school tests, but also how to interpret how that'll impact on quarantine time. So we'll probably stick with what we have now through the end of the semester and use that time to train and get in-school testing programs going. Here in Forsyth County, I doubt all of our schools will have in-school testing, but the ones with the highest rates and where the need is highest, we'll try to get that going. So we have now been vaccinating kids for about a week, and it seems to be going well. A fair amount of demand for vaccines at the health department. We've done several hundred now in our health system, and there are some private vaccination groups, and they have been busy also vaccinating kids. I've heard that the kids are actually comparing and showing their Band-Aids in their school classes and finding out who's gotten vaccinated and who hasn't. So it's time to come forward to that. If you can get your 5 to 12-year-old vaccinated in the next week, you're basically, by the time we hit the holiday season, the Christmas, Hanukkah break, your child will be fully vaccinated. And that's going to make it easier to travel. It's going to make it easier to see elderly or people who have underlying health conditions that may be in your family with a lot less worry. And so I think the program's going well. We'll have to see how many kids all turn out. I mean, it's really the parents, I think, who make the decisions rather than the kids. But I'm a big advocate of getting our children 5 to 12. Rarely children can have serious complications with COVID, and we've seen some of those at Brenner's Children's Hospital. And every time a child with serious complication of COVID gets admitted, it's pretty heart-wrenching. So number one reason is to protect your child. Number two is that you don't have to quarantine if you've been exposed. And you just get tested at day 5 instead, which means you can still go to school, you can still do your normal activities, you can still walk in with mom to the grocery store or Target, and you just wear a mask, and that makes life a lot easier. The third reason is that you don't have to do virtual learning at school at an exposure. And it also makes it much more likely that your child won't become infected and have to do virtual learning, which is not fun for anyone. And then lastly, it's going to help reduce transmission in the community and make it easier and faster for us to get out of this. So a lot of reasons to get your 5 to 12-year-old vaccinated. The vaccine's safe. I've looked at all the data myself, and I think the long-term data is going to be very good with it too. So if you're holding off, I'm not sure you need to. I'd go get it now. To get an appointment to get vaccinated here with Wake Forest, Atrium Health, Wake Forest Baptist, it would be to call 336-70-COVID, 336-70-COVID, or go to your My Wake Health account. Or you can go to our website, wakehealth.edu/vaccine, for a list of locations and appointments. The Forsyth County Health Department, I think, is vaccinating up to 8 p.m. On weekdays now. And so there are appointments available there as well. So a question was asked to us is what needs to be done to increase the childhood vaccination rate in North Carolina? Well, here in Forsyth County, I think our 12 to 18-year-olds is just under 50% or so. So we've made some headway since last September or August, when it was roughly only about 30%. And I still encourage the 12 to 18-year-olds to go get vaccinated. What do you do to increase rates? Well, it's really about the same thing that we did for adults. One is that you continue to educate people and let them know how effective and safe the vaccine is. And then two is that you have trusted medical providers and others in the family or to the family, explain to them why it's important, such as me. And we had our child vaccinated last week, so I certainly am a big advocate of it. Then you have to provide access. You have to make it easy. Not everyone has convenient transportation. Single-parent households or households with two people working have more trouble getting in to vaccination sites, so you need to have vaccine availability on weekends and after hours. You have to reach out to areas, particularly with underserved minorities and ethnic groups. It's the same formula. Kids who've had COVID should still be vaccinated because the vaccine provides a significant boost in immunity and longevity of that immunity. Had a question about what about the AY 4.2 variant? Some people call it Delta Plus. Well, the fact that the variant hasn't actually gotten a name yet, it's not really. It's a variant that bears some watching, but it's not really of serious concern. Yes, it's probably here in North Carolina. It's probably everywhere in the U.S. Probably every state's got a few of it. This variant may be a little bit more transmissible. There's a little bit of debate about it yet. It certainly hasn't powered through and overtaken all of the other strains like the Delta variant did over the summer. And it doesn't seem to be any less serious. And it's very likely that our pre-existing immunity, either from infection or from or the stronger immunity from the vaccine, will protect against this variant. I don't think it's going to be any more likely to cause a, quote, breakthrough infection. Regarding breakthroughs a little bit, so for those of you who are science-minded, there was a very good editorial in JAMA that's the Journal of the American Medical Association, last week, that you can get on the JAMA network. And it really talks a lot about what we've learned about, quote, breakthrough infections since last summer. And again, breakthrough is probably not the right word for what occurs when somebody who's been previously vaccinated gets COVID, because it's really not like we have a suit of armor on and that something breaks through that armor. And what we've learned since last summer is that transmission of COVID from a person of transmission, and I said that having COVID transmission from a vaccinated person to a vaccinated person is pretty unlikely. And we know that also now from our university experiences with people with roommates where both are vaccinated and one gets a breakthrough COVID. The other thing is that when people who get COVID who've been previously vaccinated, their viral load, while it might go up just as high, it doesn't stay there very long, and it drops fairly quickly. And that's because the immune response, the memory immune response, kicks in and drops it. Also, the amount of virus that's shed, even at the height of the viral load, a lot of that is measured by messenger RNA, and that's a PCR test. And some of that it's picking up are actually dead viruses and not transmissible. So it's probably less of a problem even at peak load than it would be for an unvaccinated person. We also know that severity of infection is much less in people who've been previously vaccinated. Much more likely to be a cold, an annoying cold or sometimes a bad cold, but one that's not going to land you in the hospital with pneumonia. Hospitalization rates are much less in people who've been previously vaccinated. And most of the time, the people who do get hospitalized who've been previously vaccinated are at the extremes of age, well over 65, or have a lot of underlying health problems, or are immunocompromised. That data just gets stronger and stronger and stronger every day. There's still some debate about what the significance of a breakthrough infection is. Yeah, there is some transmission from breakthroughs, even though it's less than in an unvaccinated. So it is contributing to our case counts that we have in the region, and particularly for people with underlying health problems or at the extremes of age or immunocompromised, it's serious business. So boosting helps. Boosting gets the immunity back up to where it was after the initial series. We know now that boosting not only prevents hospitalization and serious disease, which is just kind of there's no question of that at all, but it also prevents symptomatic infection in people who've been boosted, so you're less likely to get a COVID cold. People who are over the age of 65, people with underlying health problems, people who've got the J&J vaccine initially should go get a booster now. I think if you're traveling for the holidays, including the Thanksgiving holiday, there's still time, and a booster would make sense. If you're spending a lot of time seeing other people or around other people, college students, educators, people who work in hospitals, people who work in nursing homes, so on and so forth, you should go get boosted. You know, a lot of the media talks about, am I eligible for a booster? I think eligible is the wrong word. You know, if you're forward facing or if you're around people, you can get a booster, and you don't have to prove it when you go get it. But I think it's a pretty good idea if you're going to be traveling for the holidays, particularly if you're going to be traveling to family members that are older or have underlying health conditions. And if they would get a breakthrough infection, it would be more serious. So you can help protect them by getting boosted. And then also, before doing such travel, right beforehand, you can test yourself. And then when you come back, you can test yourself after that travel too. Home tests are still a little bit hard to get. I recommend that everyone go out and get enough for their family when it's available and hang on to them for when you need them. If you wait till when you're sick, it's a little bit harder to go out and get one, and you don't know, it may not be available at that time. Now, I'm not telling people to hoard. I'm saying, you know, get enough for your family, and no more than that, and one set will be enough. They will become more available with time. There's some federal initiatives to make them more available. And as we've talked before, it's a good idea to do it before traveling, particularly if you're going to be visiting people who are at higher risk of having severe complications from COVID. If you're going to a big holiday party and you've been unvaccinated or exempt from vaccination, you can get tested before going to that. So make sure you're not an asymptomatic carrier. If you get the sniffles, you can test yourself to see if it's cold or whether it's COVID. So it's a useful thing to have around. So, important thing I should have led off with, Happy Veterans Day. So to all of my associate veterans out there, thanks for your service, and we certainly should be remembering our people who are serving or who have served in the past every day, and not just on Veterans Day. So I'm going to go ahead and take some questions that we had submitted for this week, and then see if there's any questions here in the group. Rachel asks, is it safe for a family of 12 to gather at grandma's for Thanksgiving? I guess it depends who's doing the cooking. 12 people, that's a big group. All are fully vaccinated adults, and grandma has had the booster shot. Yes, I think it is. If you want to provide an extra degree of safety, you can all self-test before you do it. But I think it is safe. Makes it a little bit different from last year, doesn't it? When people were being told to not travel or get together. So we have made progress in the last year, and that's a good thing. Morgan asks, is it safe to gather indoors for the holidays with several unvaccinated family members if you're vaccinated? Well, it depends a little bit about your underlying medical condition. If you're otherwise healthy and under the age of 65 or so, and yes, you could get together if you've been vaccinated with unvaccinated people. Personally, I'd feel a little bit more comfortable if the unvaccinated people had tested before, and the visit or getting together for the holidays. But the vaccine does protect you, and if you do get COVID and you've been vaccinated and you're otherwise healthy, it's going to be a COVID cold. Annoying, and you still have to isolate, but it's not nearly as severe. If you want to add another layer of protection, you put a mask on. And a mask will help protect you. Maybe your unvaccinated family members wouldn't be interested in wearing a mask, but you certainly can. And you can ask them to do so for your sake too. But I think overall it's okay. Anne wants to know, do we yet know how long immunity lasts, either after having COVID or being vaccinated? At least 6 months, probably longer, but it does wane. So the intensity of immunity, both from natural infection and from vaccination, wanes. Vaccination's immunity is a little bit stronger, it's a little bit more robust, and it's a little broader than natural immunity, and that's why we recommend people who've had COVID in the past still get vaccinated. Tyler asks a very good question, because we've talked about antiviral treatment, pills that work for COVID. Unlike ivermectin, which doesn't work, these pills that will be coming out are pretty good antivirals. I anticipate approval to be right around Christmas time, and I think the indications will initially be for people who are at risk of having severe COVID, so people with underlying diseases or at the extreme of age. Right now, there are two on the launching pad, Malnuparavir and Pfizer's is Paxlovid, something like that. I forget the exact name. They work a little differently. Malnuparavir works by inhibiting replication of the virus by messing around with its messenger RNA, and then but it won't mess with human RNA, obviously, just the viral. And then the other one is a protease inhibitor. And it's actually got two drugs in it, the actual protease inhibitor and then ritonavir, which is a drug that we use for HIV, but in this instance we use it to raise the level of the protease inhibitor. Both look very promising in early studies for reducing rates of hospitalizations and death in people who take them. And Pfizer's drug, actually, they studied it if you give it between day 3 and 5 of symptoms, and it still had some activity. Not as good as if you do it in the first 48 hours. Malnuparavir looks like you should give it in the first 48 hours for maximum effectiveness. It's like with any antiviral, the earlier you get to it, the much better it works. Now, so what she asked, if a pill's coming out, why should vaccines be mandated by the federal government? I'm not going to approach the mandate thing. Mandates work, and it's one of the reasons why our vaccination rates are going up again here in the United States. But the reason why is that treatment is not the same as vaccination. Vaccination protects you. Treatment ameliorates the disease when it occurs. So it'd be kind of like getting the pneumonia shot to prevent you from getting pneumonia, even though there's antibiotics out there to treat the pneumonia when it happens. Or it'd be like getting a flu shot to prevent you from getting the flu, even though we have Tamiflu to treat it when it happens. The best way to prevent disease transmission in a population, the best way to protect an individual person remains vaccination. There's no two ways about it. But the pills make it a lot easier for us to keep people out of the hospital and to keep people from getting serious complications for the disease, and that's important too. So both of these things are going to work together to help get our lives back to, quote, normal, because we will have something that we can do for people that actually works well. Monoclonal antibodies work, but they're hard to do, they're hard to give, they're extremely expensive. These drugs will work better than the monoclonal antibodies. The other drug, remdesivir, that's out has to be given by vein, and frankly, it's just not a very good antiviral. And so these two drugs will be something you can get from a prescription from your doctor, pick it up at the pharmacy, take it home. And so it's going to increase access for treatment to people. But we still are going to need to get vaccinated for the protective effect. So I'm really glad you asked that question. Andrea asked, do you still recommend waiting for a booster until it is modified for Delta? You know, now I don't, because I've seen the data from the boosting and the mix and match approach to boosting. We also know now that the people who got J&J initially really need a booster. They need to get it now. So I wouldn't wait. And I really haven't seen a lot of activity yet from the pharmaceutical industry about releasing the modified vaccine yet. They probably will at some point, but the wait might be longer than what I initially thought. So I'd go ahead and get it now. Any time frame for this Delta-specific Moderna and Pfizer boosters? It doesn't. I haven't seen it. I haven't seen that time frame. So we'll have to see. Hopefully it'll get announced soon. But right now, it looks like getting boosted with the ancestral vaccine provides enough of a boost of immunity that maybe we won't need that Delta-specific vaccine. Jim asked, can you please speak more about breakthrough infections? Well, we did in general, so I won't go back over that. But he does go on to ask, can a person expect in the weeks or months following a breakthrough infection? Most people who get a breakthrough infection get over it pretty quick and don't have any sequelae. The incidence of long-term COVID, the symptoms of fatigue and mental fogginess and such that some people have following COVID seems to be a lot less than people who've been vaccinated. I think it still happens, but it's much less common. So most people who have a breakthrough infection after it's resolved are basically the way they were before the breakthrough. Their breakthrough infections do increase immunity. We don't know how much yet, and so the question whether or not you should still get a booster is really largely unanswered if you've had a breakthrough, but there's certainly no harm in getting a booster if you've had a breakthrough. Sylvia wants to know, my 78-year-old friend got her first vaccine and COVID on the same day. That's bad luck. She had a few rough days, but once her 10 days were up, she had no symptoms other than being a little tired. I'm glad, Sylvia, I'm glad your friend is doing well. Is there any chance that the antibodies from both the virus and the vaccine at the same time work together to help her? Maybe, yeah, it's possible. It would be a little early since the antibody response usually is not really measurable until a week afterwards. But yeah, it could help to get better a little bit faster towards the end of it, and her viral shedding may have been a little less. So it's possible. Joy says, my 16-year-old was accidentally given Moderna for both his first and second shots. What should he get for his booster? He's still 16. That happened a few times, and I mean, every health system's had that happen to them, and every health department has. It's probably not a big deal because Moderna's been studied for the 12 to 18-year-old. Approval's going to be delayed a little bit while we gather more myocarditis data for it. But it's certainly your child is fully vaccinated, and he's still 16. He can, if he's going to get boosted or needs to get boosted, he can get Pfizer's vaccine. That's fine. Between the two messenger RNA as a booster, it probably doesn't matter much. You'll need to ask the question, does he need to get boosted right now? Since the kids' rollout was a little bit later, but it all depends on his underlying health and what he's doing. Vicky says, would getting Remicade infusions for rheumatoid arthritis every 6 weeks lessen the effectiveness of the Pfizer vaccine? Yeah, Remicade does decrease the effectiveness of the vaccine. Not as much as some other chemotherapies, not as much as steroids, but it does some. And people who get Remicade every 6 months or every 6 weeks, this is a group of people who should get a third shot. We don't call it a booster, it's a third shot series. And then 6 months after their third shot should get a booster. And that's going to be the recommendation. So if you're on Remicade or some other TNF-alpha inhibitor, you should have your third shot. If you haven't gotten it yet, go get it, and then 6 months after that, you can get a booster. Would Malnuparavir be clinically appropriate for pediatric patients? If so, when might we see a pediatric dose for Malnuparavir? Well, the short answer is yes. It would be. Kids are much less likely to get severe COVID, but that's not true across the board. There are some who have risk factors for more severe disease. This is going to be largely up to the pediatricians because the FDA EUA is going to be for adults first, just like it was for Tamiflu, what we use for flu. In fact, for a long time, Tamiflu was only technically indicated for adults, but pediatricians worked out the dosing and gave it anyway when kids needed it. So it'll probably be the same thing for Malnuparavir. I think those of us in infectious diseases and my colleagues in pediatric infectious diseases have already started thinking about it. Since Malnuparavir is 4 pills twice a day, it simply could be just by decreasing the number of pills that are given, but we'd have to compute it out by weight. So let's get the drug approved first, and then we'll talk about doing it for kids. Diane, lastly, asks, when my 5-year-old granddaughter received her COVID vaccine, her provider said for her to get her flu shot later in case she had a reaction. They want her to be able to tell which vaccine caused the reaction. When would you recommend to get her a flu shot? Now. We're going to have a bad flu year, and everyone needs to go get their flu shot. And you can actually give the flu vaccine and the COVID vaccine at the same time. We usually just do either arm, or if you only want unarmed affected, you put the flu 1 inch from the COVID shot, and it works fine that way. And really, there are so few reactions from the flu shot. It's really not an issue. So you can get it at the same time. But the big thing is get your flu shot. I think we're going to have a tough flu year. So, and like I said, staying home in bed with the fever for 3 days due to flu is really not much different than doing it from a breakthrough from COVID. So get your flu shot. Any questions from the group?
One person asked, when should you get the booster if you're fully vaccinated and had COVID post being fully vaccinated?
Yeah, we don't know when the best time would be. You could get it any time after you've had post-vaccination COVID infection. Some might wait a little while and wait. I don't know. I wouldn't wait much longer than 3 months or so, though. I'd get it sometime during that time frame. And then when you do, you'll be really boosted.
And then we had a question about testing. So this person says, how would you know that you have COVID in a 48-hour period? But they've been told that they need to wait 4 days after getting symptoms to get tested. Otherwise, it could be a false negative.
Yeah, I mean that's kind of pre-Delta information. With Delta, usually the test is positive within 48 hours. In fact, if you're unvaccinated, the official CDC recommendation, if you're a contact, is to get tested immediately that you know you were exposed, and then to get tested roughly 5 days after you're exposed. If you're vaccinated, you just need one test 5 days after exposure. If you have symptoms, I don't really think you need to wait to get a test, particularly if it's a PCR test. I think you can go get it right away. The home tests may not be quite as sensitive in the first 48 hours, but they're probably good enough.
Got one asking if you have any thoughts on holiday travel season.
So holiday travel season, I guess the one that's coming up, do I have any thoughts about it? Thanksgiving's the first one. I think we've talked about it some. I think that getting boosted is a good idea before you do holiday travel, visiting friends and family in particular. Maybe if you're going trout fishing in northern Montana by yourself, it's not as important. But and then one could consider getting tested right before traveling, and then once you come back, and the home test is a good way to do that. Wear a mask while traveling. It's still required federally on public transportation. Try to get in and out of the airport quickly. Hand sanitize a lot. And rather than take public transport, rent a car, and or have your family pick you up, which is even better yet. When you're in your car with other people, wear a mask. Cars are a great place for COVID transmission to occur, as we know. So this is just a few of my thoughts. All right, well, we'll talk again next week, because in 2 weeks, it's Thanksgiving, sneaking up on us pretty quick. So we'll get together next week, and then we'll take the following week off. So thanks. Have a great week.